Colorectal cancer genetics, sporadic in 95%, HNPCC in 5%, most common inherited, FAP is less than 1%, sporadic allelic loss of APC gene, activation of KRAS oncogene, deletion of P53, DCC tumor suppressor. ठीक है. HNPCC autosomal dominant most common form of inherited colon cancer. 90% develop cancer proximal colon. Amsterdam, less than or equal to 3 family members with colon cancer. Cases span at least 2 generations. 1 case diagnosed before 50 years. FAP autosomal dominant, 100 polyps, 30 to 40 years. Mutation tumor suppressor gene, APC on chromosome 5. Genetic testing, analyzing DNA. Rule out duodenal tumors, Gardner syndrome, osteomas of skull and mandible, retinal pigmentation, thyroid cancer and epidermoid cyst. ठीक है. Gastric cancer, this is less common than colorectal cancer. It's slightly less common than esophageal cancer. This is a cancer of older people more than 75 years, male predominance 2:1. Risk factor H. pylori triggers inflammation, mucosa atrophy and intestinal metaplasia. Atrophic gastritis, diet, salt and salt preserved foods, nitrates, smoking, blood group, clinical feature abdominal pain, vague epigastric pain, dyspepsia, dysphagia, upper GI bleeding, lymphatic spread, left superior supraclavicular lymph node. Diagnosis endoscopy with biopsy, signet ring staging, CT. Management endoscopic mucosal resection and partial gastrectomy, total chemotherapy. Refeeding syndrome, metabolic abnormality, extended period of catabolism switching to carbohydrate metabolism. There is decreased phosphate, potassium, magnesium and abnormal fluid balance. हाइपोफॉस्फेटेमिया में आपको क्वेश्चन आएगा मार्क्ड मसल वीकनेस, ठीक है, इन एनी ऑफ दिस कॉज. मैग्नीशियम डेफिशिएंसी में टॉसाइडेस डी पॉइंट ए होता है. देन प्रिवेंशन, हाई रिस्क, BMI लेस देन 16, unintentional weight loss of more than 15% over 3 to 6 months, little nutrition intake for more than 10 days. If there is more than or equal to 2 BMI is less than 18.5, unintentional weight loss of more than 10% over 3 to 6 months and little nutrition intake for more than 5 days. ठीक है. There is history of alcohol use, drug therapy including insulin, chemotherapy, diuretic, antacids. Prevention, starved for more than 5 days. If the patient is starved for more than 5 days, first 2 days you feed at 50% of what is required. ठीक है. So what are the high risk group? Again I will repeat. If the patient has got less than 16 BMI, if there is unintentional weight loss of more than 15% over 3 to 6 months and little nutrition intake of more than 10 days, if there is more than or equal to 2 BMI less than 18.5, unintentional weight loss more than 10% over 3 to 6 or little nutrition intake for more than 5 days, or history of alcohol use, drug therapy including insulin, chemotherapy, diuretic and antacid. अगर इन तीनों में more than 2 रहे then there will be refeeding syndrome के possibility. Varical hemorrhage, first you check the ABC, airway, breathing, circulation. Correct the clotting factors by giving FFP, fresh frozen plasma or vitamin K. Then you give vasoactive, terlipressin or octreotide. Terlipressin is always preferred. Prophylactic antibodies reduces mortality with liver cirrhosis. Offer IV antibiotics in cirrhosis who have upper GI bleed. Suspected varicose में terlipressin plus IV antibiotic can be given. Endoscopic varicose band ligation, Senstack and Blakemore, uncontrollable hemorrhage, transjugular intrahepatic portosystemic shunt TIPSS, connects hepatic vein to the portal vein. Exacerbation of liver encephalopathy is very common. Prophylaxis propranolol decreases the rebleeding and mortality compared to placebo. Endoscopic varicose band ligation is the eventuality.